One of the challenges is that we just didn't have enough staff to start with. I mean, to say a skeleton crew would be a woefully overestimation, of what we had.
We
We had
were an embryonic
a
stem cell crew.
skeleton
Yes,
crew,
yeah.
and it was actually really quite terrifying for me as a physician.
Hey, welcome to the Take Charge podcast today. I'm excited to be here today with my co-host Lee Aase. And also we have Dr. Dave Strobel with us again. Dr. Dave has played a key role in HELPcare and the direct patient care that we offer through the clinic. And recently we did a podcast with Dave where we talked about kind of his background and his history, what brought him to love medical care and the journey he's been on, and took up right up to where Dr. Dave and Lee met for coffee on October 12th in 2019 and started the discussion about healthcare. So I'm going to turn it over to Lee to start the questions here.
Yeah, Dave, Dave and I were in a small group Bible study back in together. We went to church together in the mid 90s. He was my doctor, my primary care doctor until he left the Mayo system, which bitterly disappointed me and as well as many others. But we still stayed in touch, and we would run into each other in the grocery store or other things like that. And he had I'm not sure who initiated the getting together for coffee, but we got together for coffee, and it was just kind of a catch up, see how things are going. And I was really
We didn't have an
satisfied.
agenda.
What's that?
We didn't have an agenda. It was
No, there really was no
see
agenda. It was
each
just
other in a while.
catching up. Yeah. And so we got together at the coffee house on Main in Austin, and he started talking about, first of all, some of his frustrations with being the medical director for one of the local nursing homes, and kind of just distress with how some things were handled as he was referring patients or as they were getting into the hospital system. He was also then telling me about this clinic where he was working that was owned by the pipe trades unions. So Dave, maybe we can kind of recap a little bit about that and your perspective on that discussion.
Well, there's the pipe trades unions in Minnesota and a little bit in eastern North Dakota, where they have benefit packages. They had a health plan, which is called their welfare thing, and that's not what it was called, but that's what it is. And then there's a pension plan that was part of that. And they were, for a long time, each of the unions was administering their own plan. But then there was this other company that was set up to try to centralize that. It's called Pipe Trade Services Minnesota. And so that was basically the benefit management company. And then the pipe trades unions, plumbers and pipe fitters and sprinkler fitters and steam fitters and all that kind of thing, then they would pay part of each of their hourly wage into this company, and then that company administered the benefits. Well, they got tired of the increasing costs in healthcare. Their pension fund was just fine. It was an award-winning pension fund, but their welfare fund was spending more and more and more, and they weren't getting any better outcomes. In fact, their outcomes were really bad. For a time, the average pensioner from that company would basically retire, and then they would collect about 7 monthly pension checks on average before their death. So it was a very metabolically unhealthy group of people. So it wasn't that they were working themselves to death. They were basically just living themselves to death. And then by the time they retired, there was basically nothing left, and they just would basically die very shortly. So they got tired of having this award-winning pension fund that was being given to widows for the most part, because most of these guys are guys. And so they said, this senseless. We got to do a better job of taking care of our people. So they said, let's buy our own clinics, hire our own doctors and nurse practitioners, and develop a system that's just like totally outside the normal system. And so that's how it started. And then they came up with a bad name, which is Pipe Trade Services Minnesota Family Health and Wellness Centers, which is a terrible name. They should have named it something else. But anyway, that's where I was working.
Well, and that really kind of struck me at that point, because at that point I was working for Mayo Clinic and was loving that experience. I mean, I'm very grateful for that experience that I had there. I was in the process of planning our Middle East Healthcare Social Media Summit in Dubai. And Dan, you were one of our participants in that as well.
Right.
So this was our first one in Dubai. It was actually our third one that we'd done all together. Well, we were planning on doing that the following December. And so I would say, fat and happy in my job. I was not looking to do anything different. But hearing Dave talk about this plan and what the benefits were like for the pipe fitter, for the members, that anybody could go to the clinic for free, that they had $0 out of pocket for that they got their medications free, they got their lab tests free. And I just kind of said, wow, wouldn't it be cool if we had something like that in Austin, in our hometown, where people could just buy a membership, where they didn't have to be a member of a particular union. And at the same time, Dave was saying, I mean, I heard him kind of saying, well, it'd be kind of cool if we had something like that in Austin, but I don't know how we could do this. So, yeah, your perspective on that, Dave.
Well, and I had actually spoken with Jim Hines, who was the mastermind behind the clinic program at Pipe Trades, and I had told him, "Gee, Jim, why don't you split this thing completely away so that it's an entirely separate entity, has its own board of directors, and then the Pipe Trades Welfare Fund basically pays a membership to that clinic so that their members can go there just like they have been, but they're not running the clinic anymore." Now a separate board is, and now we can go out and say, hey, firemen, would you guys like a membership? Or, electricians or teachers or individual families, whatever. And he had tried to do that in setting it up. He had several different unions from different industries that were saying, oh yeah, we're going to do it. And what it turned out is that it was like the little red hen. Everybody said, oh yeah, I'm all okay with that. And what they wanted was basically just the end product, but not to invest anything. So when I spoke to him about this idea that if he were to split this away and actually make it into a separate entity and just have the pipe trades pay the membership, and then they get the best membership cost, and then everybody else pays a different membership, he was very negative about it because he'd kind of been burned already by the other members of the other unions that had said, yeah, we're in. The rubber needed to meet the road. They said, no, we're out. So that was really tough. So I thought, well, but it is the right idea. And so when I talked with Lee, I'd been thinking about this. It's like, we need to have a community-based thing, but I gotta have a community member, a thought leader from the community that catches this vision and picks it up. And I had no idea that I was just sitting with him, So that was the thing, is like, I thought it was maybe somebody with the Hormel Company or somebody with the Chamber of Commerce or some other big business person or something like that. And here I'm having coffee with him, which is, I'm sure, God's providence.
Yeah. Well, that's kind of what I would say is I went into this meeting. But I didn't have an agenda. I kind of didn't know what I was going to do for the rest of my career. I was really happy in my career working at Mayo Clinic and with their social media program. But I was probably, I guess, 56 years old at this time. And maybe even 57. So
Much younger
2019,
than
I was 56. You were 57. Right. Okay. I was 56. You were 57. But I also I knew I was 10 years away from Social Security retirement age. And I didn't think it was likely that I would want to retire at age 67 as the social media guy for Mayo Clinic. And so I was open to thinking about something else. And like, did not audibly hear the call of God. I did not hear the voice of God, but I did feel really a prompting inside to say, you know what? We should do this. You should do this. We should have a clinic like this in Austin. And so it was at that coffee breakfast on October 12th, 2019, that I said, Dave, I'm going to call Western Governors University. Not call, I'm going to contact them, and I'm going to see about going back to get my MBA in healthcare management, because I'd been communicating about healthcare. I'd been promoting Mayo Clinic services, but I hadn't actually run a clinic, or didn't have that hands-on kind of experience. And I thought it'd be helpful to have some more formal training in this if we were going to try to do it. So that next Monday, I logged on to the site, applied. I started December 1st. December 1st of 2019, I started my course. And this is another thing where I said, I don't know for sure that I heard God's call. I did feel a prompting in it. But so many things have happened since then that have just been such affirmation and confirmation that I increasingly am convinced that this is very much feeling that this is something that we've been called to do. And it's our way of loving and serving our neighbors and serving our community. So just one quick example of this is that when I was working at Mayo, there was a tuition reimbursement program. And I was at the point in my career where to advance any further at Mayo as a division chair or department chair, I had a master's degree. I had at the time a BS in political science. And yes, BS and political science do really go well together. And then COVID hit, but just because of when I got into the program, I was kind of grandfathered into it. I ended up being able to get my MBA for about $2,000 out of pocket and most of the rest of it reimbursed. And I just have to say that if I would have waited 5 months to start, I would have gotten zero. I would have gotten no reimbursement whatsoever, and I probably wouldn't have done it. Yeah. And I don't know that it was 100% necessary for me to have the MBA, but it's sure been helpful. And that's just one of the many things that we've seen, happen over these last, well, actually, it's 5 years now, a little over 5 years since we had that first coffee, where we're just seeing, confirmation that we're on the right path and we're doing something good. So that's fast forwarding about, it was April 3rd of 2021. That we had coffee again. We sort of had coffee every once in a while over the next couple of years to just kind of catch up on how things were going. And of course, there was all the COVID lockdowns and shutdowns and everything that were, kind of interfering at the time as well. However, April 3rd, we were having coffee again when I got notification that I had passed the final project to get my MBA. And then at that point, my goal was that I'll work for a year at Mayo, save up maybe $5,000 a month to live on. And then when I get to age 59 and a half, so I'd retire at 59, which would be May of 2022, that I would retire then, that I'd live off for the next 6 months off of that $60,000 or so that I was planning to save up. Lisa at the time, my wife Lisa, was saying, do we need to do it that fast? I mean, because she was really liking that I had a good salary with a very stable employer, and she loved the security. At any rate, as we look back now, that would have been woefully inadequate, having $60,000 as our stake. But I found out that I could retire with a lump sum pension, which has enabled us to be sustained during this time as we've gotten things started up. And as it turned out, we were able to open our doors on February 1st of 2022. Dave was still working with the Pipe Trades Clinic 4 days a week. So then on Fridays and Saturdays, he'd work with our fledgling clinic that started out with about 100 or so, 105 founding members.
Well, and I'd like to ask each of you, as you started the clinic there in 2022, what were some of the major challenges?
Oh my goodness. Well, they were numerous. One of the challenges is that we just didn't have enough staff to start with. I mean, to say a skeleton crew would be a woefully overestimation, of what we had.
We were an embryonic stem cell crew.
Skeleton crew. And it was actually really quite terrifying for me as a physician. The very first patient that I saw was somebody that had an endocrine condition that I had never managed before. And I did just fine, but it was, what in the heck have I gotten myself into? That kind of thing. And so that was really a scary time for me as I was realizing, oh my goodness, this is really, I'm by myself, not really, but very, very much medically by myself. And what in the world have we gotten ourselves into? But God is good, and He has grown things slowly enough so that we can at least go from one terrifying situation to the next one, having resolved the previous one with reasonable facility.
Yeah,
we're constantly terrified, but it's new terrors
right,
as we move along.
Yeah, I think one of the, from my perspective, in December of 2021, we had a decision to make on, do we sign a 5-year lease that obligates us to about $200,000 of payments, how do we, like, what if nobody wants to do this? Like, what if there isn't a market for this? And so what we did was we got founding members to join with us. We got them to, because what we didn't want to do is have people say, yeah, we think you should do this. And kind of like the little red hen thing.
Yeah.
And then say, well, I just said you should do it. I didn't say I wanted to join. And so we got about 125 people to put in a $99 deposit to say, yes, I want to be one of the founding members. And they get a preferred lower rate as members for their faith in us as we were starting, because when we started, we were a day and a half, and we weren't able to provide all the service. We didn't have an on-site lab. I mean, there was so much that we didn't have at that point, that their faith in us in the beginning, that this was something that they were wanting to see happen, really, really helped. But I will still say I got COVID in early January of 2022. And I wanted to just run away. I was like, this is, oh man, what do we even get ourselves into? But we had some great folks who stood around us and helped us. One of them loaned us a trailer and his van to go up to a used medical equipment place so that we would have exam tables. And we got about $25,000 worth of equipment for about $5,000 because we got it used. And just being able to be resourceful with that and kind of having faith that we'd figure it out as we went along. And we definitely have had mistakes along the way and things that we've learned from. But like, for instance, on the first day, we didn't have a nurse. My wife, Lisa, was our receptionist, and she did the vital signs. We didn't have Wi-Fi. We had to use a mobile hotspot, to be able to have internet access. So it was very much, if you look at, probably in the show notes to this, we'll post some links to some of the blog posts from back then where you can see how spare the facility was here as we got started. But we definitely saw that there was potential.
So what kept you both going?
Prayer.
Prayer, yeah, absolutely. And also knowing that, we have this 5-year lease. Like, we got to make this thing work. Like, and also just, we did get encouragement. We saw, we had people continuing to, join with us and to express faith that we closed our founding member phase in early April of 2022, and we had about 300 members, at that point. And so from that, we were starting to see that we're starting to get some traction. And I think in the aftermath of COVID, there was, back in 2019, we thought there would be an appetite for this. And then in the aftermath of COVID, there was definitely kind of a loss of trust in some of the rest of the healthcare system, and people were looking for an alternative, and so I think that was encouraging for us as well. Still lots of bumps along the way, but it was the other, and we're, in a future episode coming really soon, we're going to interview our first other practitioner who joined us, Stephanie Kimmis. And so sort of the story of how she came to us as well through a friend at church was, again, some of that provision of the right person at the right time for the right amount of time per week that enabled us to continue to grow this while Dave was still continuing to work. First, he started a day and a half with us and 4 days with the pipe trades. And then he went to 3 days with the pipe trades and 2.5 days with us. And, this is really something that the fact that he was gradually able to wean himself off of that paycheck and be able to have us build up the membership to be able to not only keep him busy, because that hasn't been a problem, keeping him busy, but to be able to pay the bills, has been really good.
So to put those early days in context, today, how many providers and how many members?
Today we have just over 1,800 members. And so we're so thankful for that. We've tripled our membership in the last 2 years. We increased by about 75% as of the first of the year because we got some employer-based plans that included, our membership. We have 4 providers, 4 practitioners, Dr. Strobel, as well as then Stephanie Kimmis, who is our first nurse practitioner who joined. Then Elizabeth Hedlund, our physician assistant, joined in February of 2023. And then just last fall, Danae Boersma is our nurse practitioner, moved back from California to join us. And some of the upcoming episodes will be interviewing them as well and having them tell their story about why they wanted to practice this way. So maybe I think Dave, Kind of as we sort of wrap today, if you were to talk a little bit about how you see this direct primary care model, and in particular what we're doing at HELPcare Clinic, as why that really resonates with how you wanted to conclude your career as a doctor.
Well, direct primary care is basically mostly a membership-based thing. And if you look at, for example, dpcnation.org, that is at least one clearinghouse of a bunch of different direct primary care clinics. And if you look at how they're paid and what their fees are and things like that. They're like kind of all over the board as far as what they do. They all have different business models, and some of them are telehealth only and that kind of thing. Most of them still kind of operate within the normal allopathic medical model, which is allopaths are normal doctors like MDs. And so they operate. I mean, I kind of jokingly say that most allopaths are basically pharmaceutical representatives. And so their job is, what's your diagnosis? Here's the drug that treats it, that kind of thing. And so what I think is a little bit unique, or not unique, but clearly different about HELPcare is that not only are we doing the direct primary care model, which is basically about how it's paid, but we're also focusing more on what we refer to as functional medicine. And there's an Institute for Functional Medicine and Functional Medicine University. And what this is basically, how about if we just not come up with a diagnosis on how do you patch it, but start asking the question, I wonder what causes this, and if there's a possibility of learning what causes it, maybe we can figure out how to deal with the cause rather than treating with a new medication. So one of the things that's very interesting about HELPcare is that we have a fair number of patients who are beginning to use some of the lifestyle changes and the supplements that we can recommend and are getting off of their medicines, and yet controlling the conditions that the medicines were designed to control. And that's a fairly common thing, very gratifying for physicians and other practitioners, and very, very gratifying for patients as well. They're delighted that they don't need to depend upon these medicines. And we're not always successful, and not everybody's interested in that. But, when they're interested, we're at least willing to ask the question. And it's a very rare patient who goes to a regular allopath, and the allopath says, I wonder if your med list is too long. I mean, they don't have the time to do that. They don't have the inclination to do that. And who knows, there might even be perverse financial incentives to make them not want to do that. But that's not what HELPcare is about. We're really about how do we help people take charge, which is what this podcast is all about. It's not about us. We don't fix things. We help people understand how to fix things themselves, at least as much as possible.
Yeah, and I really think that membership model, even though it's common to direct primary care, I think that's a great part of direct primary care, but it really focuses on the membership, and with membership meaning a relationship. We're not just a commodity, come and get your pill dispensed or we do acute care. And when I say we, I mean the practitioners. I'm not one of those, but we help the practitioners be able to provide that kind of service when needed, because sometimes it's needed. Sometimes you have a sore throat or earache or a thing like that needs to be treated. But having that time for the conversations, having that time to build a relationship and to create that trust, to build that trust, and then to be able to give good counsel to people who are willing to take charge of their health, and then giving them the tools and support to do that it's really gratifying for us.
Well, great discussion today. It's been really fun, I think, to hear about the background, how you came together, those early days that were scary and frightening a bit, but then the commitments that moved you forward. And we're thrilled that HELPcare is here helping patients today. So thanks for everything that you've done and you are doing.
Thanks, Dan, and thanks, Dr. Dave, for being willing to take the plunge and kind of step away from the salaried work to be able to make something new. And we're just excited to have the opportunity to grow this as well and be able to provide this in some other communities and meet those needs on a broader basis.
That's our hope.
Thanks for joining us. If you enjoyed this episode, be sure to leave a comment or a review, and to subscribe on Spotify, Apple Podcasts, or on YouTube. And also to share Take Charge with HELPcare with your friends and on your social media channels. At HELPcare, our passion is helping people take charge of their health and their health care, helping employers take charge of their health plan expenses, and helping physicians and other practitioners take charge of their healthcare careers. Learn more about the HELPcare Clinic difference at HELPcare.health.